going to talk this morning about a little discussed topic, but the truth is we should be willing to talk about it a lot more. So we're so happy to have Dr. Jeff Mullins, a urologist with CHI Memorial, here back with us on the show, talking about Continence Week. And as told you earlier, let's get out of the 8th grade here.
Right.
Because the truth is, some 25 million Americans suffer from some type of a continence issue.
Yes, urinary incontinence is a very, very common disorder in men and women of all ages. Of course, it's more common as people get a little bit older, more common in females, but it's a big part of a urologist's practice.
And the reason that you do tend to see it more in women than in men is because it's sort of just nature evolving, right? As women have children, the more children you have, that alters your body.
Right. As women have more and more children, there's changes in the pelvic anatomy, and it just puts them at risk for incontinence. Also, women have a much shorter urethra than their male counterparts, so that's also a reason why they suffer more on average than men with urinary incontinence.
And the reason we're focusing on it is because this is a week dedicated to it. Let's face it, we all see those commercials on TV that no matter what it's for, whether it's for depends or medication or procedures. And the truth is, you said it's different for every person, which is why it's so important to go see your doctor.
Right. Like most things in medicine, there's a real individualized, personalized approach to any kind of problem, and incontinence is no different. Why someone suffers from incontinence can vary drastically between person to person. Some people have bladder overactivity or the bladder squeezes inappropriately. Some people have problems keeping urine in the bladder or stress incontinence. And some people's bladders just don't work at all, and that's the reason why they leak urine. It's very important to know which one you're dealing with, because the treatment of either of those things is vastly different.
In terms of the ability to have it treated successfully and not have to live with an embarrassing situation or just an altering situation, because you hate to have to be in the middle of a conversation and say, excuse me a minute, and head down the hall, people can get help rather quickly.
Right. The important thing to know if you suffer from this condition is that you're not alone, that there's just tons of people out there suffering, and the first step is just going and getting help and having a good, compassionate conversation with your doctor. Some people can be fixed with physical therapy, some people need medications, and really the procedures typically done to cure incontinence are typically outpatient, very minor procedures. So although not everyone has the perfect result, we can typically make a fairly meaningful impact in people's quality of life.
I would never have thought of physical therapy. I was at a local physical therapist over the last few months for one of my daughters with a leg issue, and in her practice, she now has a physical therapist who does just this type of work, because it provides, like you're talking about, that nice conversation and some privacy a little bit and just some peace of mind.
Right, and if you can fix someone's incontinence with physical therapy, some muscle training, some biofeedback, avoid pills, avoid surgery, that's probably the most happy patient you'll ever have.
You do mention that it happens in men as well. I asked you before we went on the air if it tends to occur kind of at a specific age, but you said not really. Generally people are older, but it can happen anytime.
Right. Incontinence is more common as we get older, but you certainly see a fair number of patients who are younger in their life, and that they're suffering too. So it's important to understand that it can affect anyone at any age, and people should seek therapy. And
so where to go? Your office can help people. Urology associates there at Memorial. Right,
and we work very closely with the Continence Center at Memorial as well, and between their group and our group, we can typically help most people.
And the Continence Center, and people have known it as that for years, it's now called the Pelvic Health Care Center,
right,
because you encompass lots of different types of help within that one center.
Exactly.
And there's their phone number as well. Both you'll find at CHI Memorial on Glenwood Drive. Dr. Mullins, thank you so much.
Thanks for having me.
It's good to get out of the 8th grade, isn't it?
It is.
We're back after this.